Hey there, I'm Dr. Cammisa. Welcome back to our video series, and today's topic is going to be on the shockwave and Prolo Therapy. Why do we combine Prolo Therapy with shockwave? We're going to find out why. If you're new to our channel, hit the subscribe button, give us a thumbs up, and turn on your notifications. Stay tuned, I got lots to share. And before we get into too much detail about the Prolo Therapy, I'll put a link down below in the description for a video that we did on describing Prolo Therapy, what Prolo Therapy is. I'm also going to put some links about the shockwave therapy, how it works, and I have an example there about for neck pain. So I'll put a link down below. And then I'll also put a link below behind me for this, which is how we do the injections with a guided ultrasound, high-def guided ultrasound. So there's going to be links down below for that. Whether we're talking about Prolo Therapy, PRP therapy, or stem cell therapy, those all fall under the umbrella of regenerative medicine, regenerative therapy, regenerative injections. So really, what does that mean? And why have we decided to combine some of these technologies together? Well, when we're talking about regenerative medicine, we're trying to get your body to stimulate the healing process. We're trying to get your body to heal the tissues that have been injured for so long. And I say for so long because 99% of the patients that we see don't come in with an injury that just happened yesterday. They come in with an injury, and let's be honest, they come in with an injury that's been plaguing them for a long time. Whether it's 10 years, 20 years, 30 years, and they've waited long enough to say, okay, maybe I better do something about this. I don't want to have surgery. I don't want to have a knee replacement. I don't want to have a hip replacement. What is out there to help me? And so all these different types of therapies are trying to stimulate the healing process. And there are times when we need to combine shockwave with injection therapy. And I'm going to explain that now and why we would do that. So when we're talking about trying to get Prolo Therapy, trying to get joints to heal faster, trying to get joints to be restored or regenerated, we need to look at the surrounding tissue. And you're going to see some pictures down below in a few minutes here where, let's say, for example, we're just doing a knee. Someone's got a knee issue and it's been going on for years. Well, it's not just, yes, you have pain in the knee joint, but it's not just the joint itself. It's all the surrounding tissue that has been affected. In essence, it's like you're driving the car, you're going straight, but that wheel is turned like this. And it's been turned for so long that all these tissues have responded to that altered mechanics, so that altered stress that you've been putting on the joint. Whether it's a knee, ankle, hip, doesn't really matter, but in this case we're talking about a knee joint. So when you have this chronic situation, all the tissues on one side, everything has just been tightened up. You have scar tissue, you got all this fibrotic tissue, you have muscles that are in spasm, you have muscles that have been weak and atrophied. And so, yeah, you want to get the joint to start to heal, but you also have to get all the tissue that supports the joint to start to function better. And it's not just the knee joint. You have to work up and down on both sides of that joint, into the thigh, into the hamstring, into the calf muscle, to address all the situation, all the tissue that has been chronically deconditioned over all these years. And that's where the combined technology has this synergistic effect to start the healing process. So I'm going to go in just a little recap of what happens with the shockwave therapy. So when we're looking at the shockwave therapy, this is radial shockwave therapy. And so the shockwave therapy is sending an impulse of energy into the tissue. That impulse of energy is doing several things. First of all, it's creating new blood supply. It's improving existing blood supply. Everything is about blood supply. We need blood supply to heal the tissues. So improving blood supply, creating new blood supply, decreasing inflammation, breaking up scar tissue, stimulating muscle tissue, and it stimulates the growth factors. Yes, it's like a baby PRP, it's like a baby Prolo. Every time that we do a shockwave therapy on an area of the body, we're creating that area to be stimulated, to change, and to grow. If a muscle's been atrophied, we want to increase the blood flow to that area, bring all the healing factors to that area, so that when we give you an exercise to strengthen that muscle, now we've got some building blocks to work with. I hope that makes some sense, because we get asked a lot of questions, on average, how many sessions will I need? How many treatments will I need to get my knee back to brand new when it's been 20 years of neglect? Well, there is no average. Every condition is unique. Let me say it again. Every condition is unique. Your knee, your hip is like no one else's. And so, yes, we use the ultrasound, we use x-ray, we use every tool that we have, the shockwave, we use everything we can and assess, okay, you have a problem with a joint, we're talking about a knee joint, so yes, you have a problem with a joint, you have a problem with a meniscus, you have a torn meniscus, you've got a laterally displaced kneecap, whatever the situation is, we have to diagnose the condition. Once we've diagnosed the condition, then we got to figure, okay, yeah, just injecting the joint, well, that's okay, but it's not going to give you the kind of results that we're used to seeing, because we want to look at the total picture. A knee joint is a weight-bearing joint. The most common things we see are knee, hips, and shoulders. So I go to the knees all the time, but yes, we do spine, we do neck, we do shoulders, we do elbows, wrists, fingers, everything, toes. And so when we're looking at the joint, we want to encompass the entire biomechanics so that we can assess exactly what areas of the spine, what areas of the pelvis, what areas of the surrounding tissue needs to be addressed with shockwave. Yes, we need to stimulate the joint with the injection of Prolo Therapy, but we also need to stimulate the supporting structure to get that to heal better. With the combination of different types of therapy, whether it's Prolo Therapy and shockwave, or PRP and shockwave, or stem cell and shockwave, we want to get the tissue, like I said before, we want to stimulate that tissue and start the healing. And so I have to say and stress again, the most critical thing that we can do is to diagnose the condition and find the appropriate therapy for you. And yes, the lot of success that we have in this clinic on these cases is because we take a comprehensive look at everything that's affecting that joint. And when I say comprehensive, it might be a foot issue or an ankle issue that's affecting that knee. So if we just inject that knee, then we're only doing part of the problem. Yeah, the knee is the problem, but it's going to come right back again. Or if it's the other way around, maybe it's a hip causing a knee problem. We want to look at everything. And if our goal is to empower you to live your best day every day, then we can't miss anything. We have to go beyond quote unquote normal. We have to go beyond what is expected in the medical community. We have to continue to raise the bar. This technology here is from Europe. We're always raising the bar here to find better solutions for patients, better outcomes for patients, so that we feel when you walk in our door, regardless of what condition you're walking in with, we got you covered. We got it. We got it covered. I'm that confident. I'll put our clinic against any clinic in the country because of how we do such an extensive, detailed analysis and want the best for you. Yeah, because it's all about you, empowering you to live your best day every day, not once in a blue moon. So until next time, stay tuned, turn on your notifications, give us a thumbs up, share us with your friends. If you have any questions, check the links below, give us a call. Until next time, have a blessed day.